My name is Eric Brumwell. I'm a dermatologist, and I work at the Bainbridge Island Medical Center facility. Dermatologists are physicians who deal with the health of people's skin, hair, and nails. I think it's a great field to work in. There's a broad range of things that we deal with, a lot of heavy academic training along with a lot of procedural training, and that ends up giving us a skill set that's great because it allows us to diagnose complex or troublesome rashes for individuals, and it also allows us to do a lot of procedural things like injections and biopsies and skin cancer surgeries. So it feels good to know how to do a lot of things. I have special interest in the diagnosis and treatment of precancerous and cancerous skin lesions in individuals. I'm originally from the East Coast. I received my undergraduate degree from the United States Naval Academy, and then I served as a naval aviator for a number of years. I then attended medical school at Case Western Reserve University, and then served again in the Navy as a flight surgeon and as a dermatologist. After leaving the service, my family and I decided to move to the Seattle area. We love the outdoors year-round, and the Pacific Northwest is a perfect place for our lifestyle. It's very exciting in the sense that people seem to be much more knowledgeable about the effects of ultraviolet light exposure and how it increases the risk for skin cancers. And a lot more people, I think, are having their skin cancers diagnosed earlier because of that knowledge. The best part of my workday is when I get to learn something new about a patient. Maybe it's something about their job or their family, or maybe it's an interest or a concern of theirs. I always respect people's modesty, but I do think that everyone has a gem of information in their personal lives and histories, and I feel that it's important to discover what's unique and special about every individual that I care for. I chose to work at Virginia Mason because as an organization, they have a tremendous reputation here in the Pacific Northwest. I can't tell you the number of times I've had patients travel from places like Olympia, Washington, or out on the Olympic Peninsula, and Virginia Mason is the only place that they would allow themselves to be treated, and it's because their family went to Virginia Mason, or they went to Virginia Mason when they were younger, and to have that reputation in the area is worth a lot.